Should I send my child who's not in perfect health back to school in May 2020? I got that question a lot in the last few weeks. I'm Annie Janvier, a neonatologist, a baby doctor, and a specialist in ethics. I'm also the mom of 3 children who had or have different medical problems. I have feared for the life of 2 of my children. The opinions in this video are mine and not necessarily representative of the institutions I work with. So many of you have asked me my opinion and suggested I make a video. So here it is. Since the lockdown, I've been really proud to be in Quebec. We were able to contain COVID. Healthcare providers are grateful. We also all have access to the same healthcare system if we get COVID. I also agree with the message from the Association of Pediatricians of Quebec that some children are really harmed by a prolonged lockdown. For them, returning to school is important. On the other hand, there's no real guidance from the government for parents, even if doctors do their best to help you. So many of you who are not in perfect health told me they had received contradictory advice from their doctors. So this is normal in the circumstances. We have some data about COVID-19, but we continue to have researches that come out every day, every week. So new results are interpreted in an optimistic or pessimistic fashion by clinicians. There are no real scientific body recommendations. So some of you also get pressured by their employer or employers who speak about how safe it is to go back to school. Why don't you send your kids back? People you work with may not get your family situation and judge you. You're slacking while they're working for you. Dear parents, our kids had enough medical crap for a lifetime, so it's normal to feel anxious and to lose sleep over this. So I'm giving you my personal opinion with my doctor's and ethicist hat, but also with my mom's hat. What we understand right now from the medical literature is that children are at very little risk when they catch COVID-19, but some of them still get hospitalized or sick for prolonged periods. Children with serious chronic healthcare problems are also more at risk. But children don't live alone, like in France. They have parents. And generally parents of school-age kids are not at high risk because of their age. Adults who are less than 40 and are in good health have little risk, even if the risk zero doesn't exist, and some of them are in the intensive care right now. Still, some parents are really more at risk because of their medical conditions, such as obesity, renal, respiratory, cardiac conditions, or immune problems. Smokers are more at risk. Men are also more at risk. There were studies showing that children were also less capable of transmitting the virus compared to adults. But now a new German study came out that shows the opposite. But we know children can carry it, or anybody who's infected, on their clothes, lunchbox, or on money they carry around. Okay, so enough with the analysis. What should I do as a parent of a child who's not in perfect health in May 2020? I think we have to answer this question with humility, using the precautionary principle. It really doesn't mean we need to keep our kids locked up until we have a vaccine. Influenza and RSV, 2 very common viruses we live with every year, seem to be way more dangerous for children than COVID-19. We don't keep our kids locked up at home every winter. On the other hand, we know a lot about influenza and RSV while we're learning about COVID-19 every day. We have to remember the lockdown was to avoid everybody getting sick at the same time. It was to flatten the curve, not to avoid everybody from ever getting coronavirus. Some of us will get it. So the following points are based on my interpretation of medical problems. I know that social problems, economic problems families face are extremely important too. For example, if a parent or both need to work to put food on the table, that's critical. If kids can't eat, they can't be healthy. So please take what I say with a big grain of salt by focusing on medical problems. So it would be safe to send my kid back to school despite her medical problems if my child's health is stable, despite his medical condition, and the health of people who live together in the same household is stable. For example, if none of us had to go to the emergency room in the past 6 months, or be hospitalized because of our chronic medical problems. If my child has asthma, I got that question a lot. If the asthma is well controlled and us who live with him doesn't have significant health factors, it would also be safe to send my kid back to school, even if he's taking or she is taking pumps. If the clinician who works with my child, who knows my child the best, his primary doctor or his clinical nurse, tells you he can go back to school, it would also be safe to send him or her back to school if you wanted to. On the other hand, I would keep my child home if I could, while I wait for more studies to come out in the following circumstances. If my child's medical condition was serious enough that she needed to be hospitalized in the past 6 months, or needed to consult the emergency room in that time period, I'm not sure I would send my child back to school. In fact, I wouldn't. This could also be in the past year if the hospitalization was complicated. I would also keep my child home if he had other major risk factors such as cardiac insufficiency or serious immunosuppression. But remember, it's not just about the child, but about the household. I would also keep my child home if I could, if anybody in the household had significant health problems or significant risk factors. For example, serious cardiac problems, immunosuppression such as an organ transplant, or if a grandparent who's over 70 lives with us, especially a grandparent who has other chronic healthcare problems. Of course, if the clinician who knows my child best, his primary doctor or clinical nurse, tells you he should not go back to school, I would not send him back to school if I could. But parents, physical health is not everything. Some children have deteriorated since the lockdown. For example, I have been in contact with parents whose child live with autism spectrum disorders. Their children were doing well, they had a rigid routine, they were developing social abilities, and these have deteriorated seriously. Others have become depressed and don't eat anymore. Some parents have also decompensated. For example, substance abuse problems have increased. Some parents who were stable have decompensated and increased their consumption or their substance abuse. This is harmful to children. So in these cases, it's a balance of risks, and we're used to doing that in a family. There's not only a child, there's all of us. Sometimes in a family, the risk of a child being hospitalized is not as big as the risk to the family unit. So we're looking at the interest of the family as a whole, not only the best interest of a single child. Remember also these questions, they're not going away. It's May 2020, but there will be questions that we'll need to ask ourselves in September or during the vacation. It's unlikely COVID-19 will vanish until then, but at least we'll have more medical data. Also, don't feel guilty about your decision. Parents of kids who are not in perfect health often feel guilty. In fact, all parents often feel guilty. I wrote that over and over again in my book, Breathe, Baby, Breathe. I see so much parent bashing on social media at the moment. It's very sad. Many perfects need to bring you down to feel like better parents. Just don't listen to them. There'll always be the perfect others who just don't get it, who complain about their lack of flour, the non-existent graduation ceremony for their older kid, and the films that they send you about all their skills they're developing during this picturesque lockdown, drowning you with rainbows. To take these decisions in uncertainty, it's hard, but you already took healthcare decisions for your child. You know yourself, your child, and your family better than anybody else. Always remember that you're stronger than you think. With all my admiration for your choices.